we can probably do is we can probably get started now.
Yep.
Perfect. So thank you and happy Friday to everyone. I hope everybody had a productive weekend. But first and foremost, thank you for taking the opportunity to attend today's webinar. As you might know, we've had the opportunity in the past few weeks to highlight a few different subjects like managing remote athlete challenges, as well as focusing on one of our integration partners, Aura, and how their product is currently being used in studies to try to detect the early onset of diseases. Today, we will learn and hear from US Ski and Snowboard and focus on the integration of medical and performance data to get the most out of the data that you are collecting. Topics that we will cover in today's webinar will include successfully integrating medical and performance data within an organization, how we are able to share data while maintaining HIPAA compliance, tips to make your own EMR implementation easier, as well as a live demo of the US Ski and Snowboard site. But before we get started, I just wanted to give a brief overview of our Smartabase system that will be featured today in case some of the attendees are not familiar with Smartabase. So Smartabase is the software tool developed by Fusion Sport that can be utilized by the entire athletic organization support staff. This can include sports medicine, strength and conditioning, sports science, sports nutrition, and all the other departments within an organization. But the tool is data agnostic. So what does that mean? It means that we can collect data on pretty much anything, and we have numerous performance technology integrations to automate the data collection process. But the real power of Smartabase is the ability to create and customize different dashboards and reports for individuals based on their roles within the organization. As you can see, we have an immense experience working in high performance industries around the world, as well as here in the United States. And we come from years of implementing EMR systems for organizations around the world, but most notably in the past few years, we have also been able to implement full functioning EMR systems within Smartabase for the North American market and organizations like US Ski and Snowboard, the University of Texas at Austin, and US Soccer. As I mentioned in today's webinar, we want to cover one of our clients, US Ski and Snowboard, who recently made the switch from a more traditional electronic medical record system over to Smartabase to house both their performance and medical data in a single space. As with our past webinars, you'll be able to ask questions through the Zoom application, and we will do our best to answer them during the Q&A session. But if we're not able to get to your question, we'll follow up with you personally afterwards. With that, I want to introduce Gillian Bower, who is the lead physical therapist from US Ski and Snowboard, to talk a bit about her own experience, some of the challenges her organization faced with using a more traditional EMR system, how her organization has used Smartabase to house both performance and medical data, and also run through the US Ski and Snowboard site. During this time, I also just want to introduce Tom Cramery from Fusion Sports Sports Science Consultant Team, who has personally worked with professional clubs, university athletic programs, as well as national governing bodies like US Ski and Snowboard to implement this type of system. Thanks for taking the time to join us, Gillian and Tom.
Yeah, thanks for having us. Yeah, good morning to everybody. I'm just going to get my screen shared here and get started on our presentation. I think, Charles, I need you to back off the screen share there. There we go. Sweet. Fabulous. So, good morning, everybody. Thanks for your patience with this. I'm definitely new to all the video platform presentations, but good morning. And I wanted to take a chance to thank Smartabase for the opportunity to share with you guys our project, to Tom for all his hard work on our platform over the last couple years, and to all of you joining us today. My name is Gillian Bower, and as Charles said, I'm the lead physical therapist with US Ski and Snowboard. I'm a Canadian trained physical therapist, and I moved to the United States in 2003. I moved from clinical practice over to US Ski and Snowboard in 2005, where I was the head physical therapist for US Snowboarding through 2012. I joined the team through a couple of hugely successful Olympic Games, and it was a lot of fun. At that point, I settled down, had a family, and I'm now based here in Park City at our Center of Excellence, which is our training facility and our rehab clinic. I also have a high performance physical therapy consulting practice around high performance PT, clinical practice, and high performance systems. I am available to assist anyone with EMR design from the sports medicine perspective if you ever find that you need support. My contact information is here, and please feel free to reach out to me as you need. So a brief overview of our sports medicine program, so you kind of have a scope of what we're dealing with when we went to design a program. US Ski and Snowboard names approximately 180 athletes each year to our national teams. Our sports cover 5 main disciplines: alpine, freestyle skiing, snowboarding, free skiing, and the Nordic specialties. With these disciplines, we field 18 teams that are spread out across the globe at any given time, other than the current time. And every 4 years, we make up approximately 50% of the athlete contingent at the Winter Olympics. In order to support this diverse and widespread group, we have an extensive sports medicine network. Our medical committee is made up of 8 head team physicians. We have 4 full-time staff based in Park City at our Center of Excellence. We have 9 full-time staff that spend most of their lives traveling on the road with our elite teams. We have 6 contract staff that travel for several months a year. And we have a group of volunteers that include 220 physicians and 60 PTAT volunteers who travel for approximately 1 to 3 years a year, 3 weeks a year. So that gives you a bit of an insight of kind of what we're dealing with when building our EMR. So why did we change EMRs? Basically, in order to keep up with the demands of today, the integration of medical and performance data is essential to be able to provide the information that is demanded of us. Really, and this relates very specifically to that primary theme of today's webinar. I think it goes without saying, but that high performance integration of data and real-time evaluation of how the holistic view of any athlete is affecting their performance is really what's needed in today's environment. We need to be able to provide that information and analyze that information to support optimized outcomes. We used to have to download files from our previous EMR, get them either to our data scientists or start hashing them out on our own through extensive algorithms to try to extract data from the combined sources. In our previous system, this was obviously really time consuming and cumbersome. In Smartabase, this allows all of these things to happen in real time together, and it eliminates all of that work. So as you know today, athletes, coaches, executive, etc., all want data and they want it now. Really, they want to know how that data interacts and what we can do to help them with it. And we want to know that too. So Tom's going to be able to demonstrate in our live environment how we've achieved this. Basically, when we started shopping for our platform, we encompassed this checklist of items that we were looking for. Our primary objective really was to find something highly customizable that we could make fit all of our staffing solutions, our athletes, and all of our sports. We wanted to be able to easily create reports and communicate with all levels of athletic departments in a HIPAA compliant manner. We wanted a single platform to share resources such as emergency action plans and sports medicine education modules on. And finally, and most importantly, we wanted a platform that our athletes would engage with and get feedback from that mattered to them. Our first year really was, we placed the priority on getting our EMR up and running. We wanted to bring our medical records systems together instead of having them all in multiple locations, some on paper, etc. We were successful in developing that through our workflows and have periodic health examinations moved into Smartabase for ease of access and cross-referencing. We'll talk about this a little bit more in detail later. This has been an integral part to providing the best care for our athletes. We built in a system of checks and balances for our procedures, which basically has included, in concussion injury resolution, they are required to have a clearance form completed before that injury can be resolved and closed. That ACLR injuries require that a return to snow clearance criteria has been checked off prior to the resolution of that injury. Provides a back check system for us to be, providing best documentation as well as best care. The integration of our force plate data was integral to our ability to evaluate our injury mitigation efforts, in which we will discuss a bit more in depth shortly here. And finally, the quote, simple things such as importing prior records from our old EMR system, that was really important to us. We wanted to make sure that we had continuity of our athlete records, as well as maintaining our ability to search prior injury history for retrospective analysis. Obviously, the training of staff and volunteers is another really important component of that, so that we have our vast network of sports medicine staff and volunteers accurately reporting information in the system. So really the tips on how to implement your own EMR more easily really come down to having a robust plan in place. You need to start the design process by knowing your needs. What is your company's structure and philosophy? How does your department philosophy relate to that? How is it different? How are they the same? How is that going to affect your communication and your information flow within your system? What are your physical therapy, your medical systems? What are your high performance systems? What does a typical day look like for your company? Considering the flow from beginning of end to end of injury, from intake, management, clearance, and resolution. What specific injuries do you need to dive more deeply in on, and what information is that going to include? You need to identify your output needs. Who needs to see what, who does not need to see what, and what kind of reports are you going to need daily, weekly, monthly, annually? I think when you're also considering research potential, what are your topics going to be? What are your questions going to be? Can you build some of that in on the front end of your EMR so that that information is super easily accessible to you? Finally, I think identifying a single person who owns the system for your organization is really important. They need to drive that system forward. Having it be a side job of multiple people tends to be disastrous, I would say, or difficult at least. You need to then identify people within the sub departments that will own that specific information. Gus Kading runs our system for us here at USSA and Snowboard, and I lead the sports medicine content side with him. So having a structure like that, I think, really helps make it easy and make sure that it happens in a smooth manner. This is a really time-consuming step, but done carefully, it will really help you create an excellent outcome for your EMR, and it'll save you heaps of time on the back end. So what do we consider our Smartabase successes? I'll admit that the biggest sigh of relief from myself came when one of my staff said to me, "It's easy to train people with, it's really intuitive." So that was a huge win for me in knowing that we kind of come around to good outcomes. I put these charts here on the right-hand side that basically represent what we produce, a couple of charts we produce annually for our executive. That process used to involve downloading the data, verifying the information, adding it to an Excel spreadsheet, creating these. And now with a couple of clicks, we've got all this information here. So we didn't even know what to do with our time this year, which was a happy surprise for us. It was just too easy. And then integrating our periodic health exams. I'm going to touch on that towards the end of my presentation here a little more thoroughly. And again, a robust concussion management system that exists within our system that standardizes our intake, our examination, records our management decisions and all our clearance steps with built-in checks along the way to ensure that we're providing best care and documenting that care. Another big win for us was on March 13th this year. We had 110 athletes and staff in 9 different locations around the world that all of a sudden all needed to come home very abruptly. Some were coming directly from Northern Italy. We needed to implement an illness surveillance system really quickly. And with Smartabase, we were able to create illness surveillance form, push it out to the athletes, and get notifications to us, reminders to the athletes who, when they hadn't filled it out, so that all information was passed around and easily accessible to everybody. This really allowed us to monitor the health of our athletes during this pandemic. And to me, this is truly remarkable. Instead of having to wait for a company to generate an update, create a form, make a release, and get it all out, which we all know can take weeks, if not months, we were able to be agile and responsive very quickly during these quickly changing demands in the world. This was really enormous for us. One of the greatest successes we have had have been HIPAA compliant communications. We've really been able to streamline all of these different types of communications within the system. We've been able to generate reports with dashboards, sharing all the relevant information with all of these people you see on the screen here. Tom's going to review these within our system, so I'm not going to go through them at length now. But I will highlight that within our rehabilitation framework here at USSA and Snowboard, we've created a rehab management team around our injured athletes. That includes the PT, the athletic development coach, the sport coach, the head team physician, and of course the athlete. Because our teams really are all over the world at any given time, it's very difficult to ensure timely and secure communication between all those team members. So we now identify those RMT team members within Smartabase and utilize the platform for communication around the athlete in terms of rehabilitation progress, physical preparation, and return to snow readiness. This centralization of information makes for clear communication between all parties and strengthens our ability to work together for the athlete and have best outcomes for them. Basically, by keeping all these communications within the HIPAA compliant platform, we are providing data security and PHI security for our athletes, which is of utmost concern for us. The basis of the structure of our EMR is our internal return to performance framework. This framework was initially designed around the rehab of ACLs, which are our most common injuries. We've since generalized it to include all lower body injuries, concussion, and we're currently working on designing and implementing an upper extremity version. This framework provides a common language for everyone in our athletics and staff departments, so everyone can easily track an athlete's progress through the injury recovery. It's also reflected within our EMR, which is why I bring it up. So I'm gonna just pull through these. So why does this matter? And why does the integration of medical and performance data matter? This is a small example of where the rubber meets the road for us. This example here provides information regarding our free ski program. In the summer of 2011, it was announced that free ski halfpipe and slopestyle were going to be added to the 2014 games, so we named our first national team. In their inaugural year of 2011-12, they had a 45% season-ending injury rate, which was staggering. Retrospectively, we went back through and compared their strength profiles, as you can see here, to our freestyle mogul athletes because they have more similar sport demands. Clearly, they had fallen quite short. So here we had a group of professional elite athletes who truly were the best in the world, all with gold medal potential, most of them in our rehab facility. Fortunately and unfortunately, as a benefit of that rehab process, we were able to introduce them to the gym and build a training culture within their sport. Over the first 3 years, we were able to get substantial gains, and they really got a lot fitter. You can see that that here in our charts, both spoken to with relative power and relative strength. So they went from basically a 2.18 newtons per kilogram of body weight strength up to 2.5 in 2014 and 2.56 in 2019. Similar gains were made in their relative power there. So they're substantially stronger and more powerful. But why does this matter? Basically, we were really happy to see that this translated for us into a real change in their ACL injury rates. Being able to look back over a couple Olympic cycles, we can really show the success and try to sell this to our athletes for, you know, getting into preparedness and training if they haven't been there before. Don't be fooled. This information took me hours and hours, and with help of other staff members, of painstaking work to pull this all together from all of our different systems. In Smartabase, we can now look at all of this information in a dashboard in real time. We can then dive into each of these annual injuries and look at what their strength and power profiles look like. Was there anything else we missed? We can also review the information regarding their crashes on snow conditions, weather variables, and the crash footage, which we can house in the system. That all helps us debrief the event and learn if there's any lessons from any injury that we can move through. So finally, I wanted to touch on our future directions with Smartabase, so you're able to see where we might go next. ACL prevention and case analysis is always on top of our list. We want to do more of this and more extensive approaches with this. How can we do better? How do we keep our athletes on snow and really minimize the re-injury rates? We have various technologies, Siren MD, blood integration, Sway, that we're still looking to integrate into the system. We also have a network of 12 high-performance club systems that produce a large number of our national team athletes. It's our goal to get them onboarded to Smartabase so that we have a robust set of data and information regarding that athlete and their health history when they are named to our team. And as well, so that we have a basis for nationwide injury surveillance at club level athletes. Again, we would like to align our world ranking lists for all of our disciplines with injury data within Smartabase as well. And finally, a big goal is really changing the culture around illness reporting and making sure that athletes are reporting minor illnesses as well as the major ones, and that data is getting into our system. So we can kind of track its influence on performance and work with individuals as well as teams on specific strategies for wellness and illness prevention. So finally here, as an introduction to our system, I'm going to play this video for you that demonstrates our athlete portal for the pre-participation medical history form. Our athletes completed their medical histories for physical exams on this form this year for Smartabase. We can easily access those records now within our EMR. That data, the system, allows for usable data to be entered to the system, and that becomes one with their medical record rather than a scanned PDF. The athletes are able to access these forms from this mobile app, and they can fill it out anytime, anywhere. This year is going to be even better for us because they're going to be able to verify their current information and just simply provide updates within the system. As we get through here, you'll see that there's a dashboard that is available for both athletes and staff to be able to track the areas of the history and the questionnaires that they have completed and what needs to be done. So most importantly, this allows us to provide best medicine and best care for our athletes by having a complete medical history that is available in a live interactive format available to us at all times. I'm going to pass over to you, Tom, now for a demonstration of the site. Thank you guys all again for your time and your interest, and please feel free to reach out to me with any questions that we don't get answered today. Tom.
Thank you, Gillian. Good morning, everyone. Before I get started, I just want to thank everyone who has joined, and more importantly, hope your families are all safe and well at these times. I Over the next 15 minutes, I'm going to be going into a live demonstration of US Ski and Snowboard. As Gillian mentioned, the system is completely configurable by the client you. And whilst you could have very similar setup, we know your organisations need to be different, and we can certainly accommodate those needs. We'll explore some of the HIPAA compliant workflows and communications through reports, and look at some of the examples of how US Ski and Snowboard also integrating their performance and medical data. But before I get started, I just want to say a huge thanks to Gillian and US Ski and Snowboard for being so open to share their workflows and a Smartabase site with our community. We hope the type of openness that they promote will increase or enhance collaboration amongst our clients and just even those listening on the webinar. I'm going to jump into the demo site now. Okay, so we're going to jump into the US Ski site. This is a test environment with fake athletes and fake data. So please be aware of that. If there are any specific questions, we can answer them at the end. But it is certainly the testing data. So you'll notice there's some patterns in there and things like that please just go through as needed. Just going to give you a quick overview of our sort of key workflow, the medical hub, and all that sort of data combined in one area. So if I click into this area, we're going to see a quick sort of summary of that athlete, their current injury, illness status, in addition to if they're a minor. So we can implement sort of safe sport protocols and principles. And then also see any flags on allergies, emergency contact information, those type of things immediately throughout the system. What I'm going to do first is I'm actually going to jump into an injury record and just give you a little bit of an idea and look at sort of how the US Soccer customized their system. So as we scroll through, there's nothing sort of too different from a normal EMR here, but one thing we just want to highlight is the difference between the OSIX coding and the ICD-10 codes. We have the ICD-10 codes implemented in this system for the North American region because we know that's a required data point to capture in your EMR records. However, there is sports coding diagnoses systems out there that are a lot more robust for the sports and actually provide a lot better data. And that's one of these examples is the OSIX coding that we have implemented in the software. And it's just about to go through an update to get the most current sort of publication out there. So those type of features are already in there and already connected to body charts, those type of things, so you can get that data back. You'll notice just some of the injury questions here are really specific to US Ski and Snowboard. There's not a lot of sort of collegiate sports out there that are going to worry about training on snow, those type of areas. But with this system, US Ski were able to customize and configure that to their needs. So that's just sort of one of the highlighted areas that we want to do or want to showcase. That can also change with the sports that you have potentially at a collegiate level, and asking different questions around surfaces, those type of things can all sort of be pushed into there. You can get rid of some of these questions. You don't have to have them all. It's completely up to you as the client. One feature I just wanted to note was the ability to upload an incident or a video, and certainly teams or organisations like US Ski, where they do capture that, have utilised that sort of feature and sort of have it all, again, housed in one place. So there's not databases across the organisation with different medical records throughout. In addition, you can see our latest physician notes, medications, surgeries, all the standard stuff, again, that we hope is in EMRs, but hopefully this showcases the intuitive nature of the system. As we scroll down, you'll notice we have our treatment table and our SOAP notes all in one area, but again, just a quick snapshot of the US Ski's use of utilising the system and tools within the system to provide quick reference tables for those onboarding or staff coming into the program. So you can go through and completely change that and provide inbuilt documentation. So you don't need to sit there and train that person over and over again, and it can actually be all built into the system. Finally, you'll notice we've just got our restrictions in our update table that will come into play a little bit more, but we can all sort of, we can have those restrictions pushed through to the rest of the system. The next workflow I'm going to go through is the physician encounter. So I just want to showcase sort of the different side of things where it's the physician logging into the system, and they want to potentially link in multiple injuries, as well as potentially multiple illnesses or even sort of prescriptions, those type of things. So in the one system, you can do that and you can tag this information. Also, it's all related and then linked back to that underlying record. The rest of it is, again, pretty self-standard, but again, we've put into their system quick links so you can get an idea on what are the 5 most recent injuries. So you can get that quick snapshot instead of asking that patient over and over again. As we scroll through, you'll notice we have our systems, review of systems, and how you could utilize that. So sort of ticking off those physician needs. But I also just want to sort of showcase one cool feature in the system that you can utilize as well. So I'm on a PC and I've put in a link to allow me to start recording and dictating to the site. So I'm just going to test this live and we see how we go. Athlete comes in today with complaints of fatigue, fever and sore throat times 3 days period. So you can, I'm going to stop there. So you can see, I went a little bit too much. You can see that you can dictate into the system and utilize that feature throughout. I will clean that up later. As we scroll through, the rest of the information is as standard, and again, you can customize and configure what those need to be. So we scroll through our objective exams, our assessments, ICD-10 codes, those type of things are all possible to push in there. And I'll quickly add some information just so you can see what that looks like. And then you'll notice down the bottom here, we've got automatic calculations summarizing that information and pulling it all together for this record and can be utilized in reporting features throughout the system. The final area just to note and sort of working on the HIPAA compliance side of things is our communications tab. If I load up this communication record, we can see a quick example of, again, the ability to tag it to injuries and illnesses, but also the ability for that user or staff member across the organisation and not just in the medical department to be able to update information on communications they've had with the athlete. So you can now have all those communications that you do over text, phone, in person with the athlete, all documented in a safe and secure way within the system, all against that athlete. Okay, now to the sort of the exciting stuff and moving through to the reporting workflows that are implemented in the system. So again, these are live with fake athletes and fake data, but again, just want to showcase what that looks like. Now, if I load this up as an example, we can see our injury surveillance dashboard. Again, not a whole lot of data in here with these fake athletes, but you can notice that we do have some sort of significant features in here. One of the areas that just want to highlight is this total encounters and getting an understanding that within the system, we can record when a SOAP note's taken down and then produce reports on that. So allowing you to give superiors and managers that type of data of how many engagements you're having with the athletes in terms of the SOAP notes and those type of areas, but then also potentially putting a price to that and showing sort of the return on investment and also sort of the resources that you utilize in the system. So just wanted to highlight that as sort of one key feature through there. Again, the next sort of things are all possible in Excel and those type of visualization tools, but we're doing it with one click of a data, with one click of the mouse. It's all live, it's loaded up, and it is linked in as soon as the injury is recorded in the system. So as sort of Gillian was speaking about before, the annual reporting, even sort of mid-year reporting can all be done really simply and really easily through this feature. You have the filters. You also have the ability to anonymize the data if you do want to provide that to potential head coaches, management, other areas in the system, other areas in the department that may not be able to understand or get access to the underlying HIPAA data. Again, these are all configurable, so you can change these out for any information that you've got in system. So if it's not an injury count by session type that you want to look at, we can switch that out with whatever data you're capturing, as long as you're capturing it. That's probably the main thing. We just need, if it's a field in the system, we can pull that through. Just sort of showing the injury occurrence and severity, just giving you a quick snapshot of that. And then finally, we've got a couple of charts to sort of show where our injuries are occurring in body area, in the onset of injury, activity, and even our athletes and how many injuries they've sort of had throughout the system. Finally, surgeries, yes, no. And then finally, this little table down the bottom that is really powerful and gives an indication of injuries that are sustained to those to that category, and then also average, total duration, those type of things throughout. So if I click through, you'll notice we can get very simply a quick breakdown of body area and see that we've missed a total of 907 days, or that's how many days the injury's been open for the 8 knee injuries that we've had. As we scroll through, you've got the other areas that you can sort of toggle through. So hopefully that gives a quick snapshot of the injury surveillance and how you can do that all automated in the system. The next one I want to show is sort of a shared report to executives and being able to, again, produce that on a weekly, on a daily, whatever sort of that period you need to provide those reports. So this is a really quick snapshot and simplistic report that gives limited information to that staff member. It's not giving the underlying SOAP notes. It's giving a quick update field that you've provided. And we're actually even turning the injury into something more simplistic so they don't get sort of bombarded with coding systems and then potentially even some HIPAA data that you can't share with them. These reports are all printable and can be shared. They can also be PDF, those type of things. So just want to make sure that, yeah, ticking that box and showing you how they can work. For some reason that didn't want to. There we go, just to show that as a quick example. Finally, just going to go back to Gillian's point with the COVID-19 and show a quick snapshot of what we put together or what they can put together with the reporting. So here we've got the athletes' responses and their latest check-in. If they've had any symptoms listed throughout that, and even temperature if they've got the ability or capacity to do that. What's cool with this this report is we've also overlaid or integrated the staff comms, and so the recent comms that they've had with that athlete in terms of date, and then also what they actually have recorded around that. So you can see that sort of quick snapshot. It can also be used as a compliance tool, and we can see really quickly any athletes who haven't completed the report as an example. Next tab on this, we've got a little bit more detail of the communication logs in the last 2 weeks. So it's just a quick snapshot to see that. So sort of going full circle and giving the information back to the staff who you're requiring to fill in this information. We're really key on that, and we really want to push that point that if there's a workflow out there, there should be data coming back and moving that through the organisation. Just a couple more minutes and we're going to now look into the performance versus injury. So this sort of quick status team overview dashboard gives us a really quick snapshot of our availability status driven from the EMR system. So again, there's no double handling, it's all automated in the system. So a quick status, in addition to some metrics from potentially a wellness questionnaire, we've got acute chronic there, and that's coming from a load form. It can come from wearables, it can come from any of the technologies that you've got out there. And then in addition, we've got our sleep duration, again, coming from a wearable or that wellness questionnaire. All overlaid, all integrated into the same chart. So it's that sort of daily report that you can get that information. Finally, you can see a quick snapshot of our availability over time, and we've got the last 14 days here loaded as an example. One of the cool features with these as well is the ability to flip these over and see the information on the back. So I was again talking about those current restrictions in the system, in the software. We can also link them into anywhere else in the system, and this is an example of that where we're pulling through the current restrictions, but that's it. We're not pulling through the underlying SOAP notes or anything along those lines. We just want that quick snapshot. So this can be passed on to other areas of the medical department, as well as sort of the coaching team and the S&C teams throughout. The last one I'm going to go through is a quick high performance dashboard, or an example of that. USSA have a lot more reports, but we're just sort of giving you a snapshot of a few of them today. This report has been developed to incorporate medical and illness data, availability data, in addition to our wellness, our training load, or our logs, sort of daily logs, aura data, and then also force plate data. So sort of pulling it all together and giving that holistic approach for either the athlete or even the squad. So you'll notice here I've got it loaded up currently as a squad, and I've got filters to go and toggle that, and I'll do that in a minute. But just want to give you a quick snapshot of the illnesses and injuries, any available modified out days, and then again that sort of simplistic look at any injury or illness data. If I go and select one athlete, I can break that down, and now it can be an individualized report as I scroll through. So that athlete and their training load, we can see that they had an illness, and we can click into that, get in for more information, including expected data return and any additional information you want to share. So in this example, and it is purely an example, we've got a high workload leading up to that athlete sort of breaking down and sustaining a respiratory illness. As we scroll through, I just sort of showcase acute chronic, again, utilising training load, but it can utilise wearable data, and you can customise what that looks like, how that interacts, everything along those lines. We've got our load versus total wellness. So again, we're integrating different data sets into one visualisation that we know that people out there are doing and taking a long time to create in visualization platforms, in Excel, those type of things. These are all pre-built and really simplistic for the user to build, not a programmer. This is all configurable by the end user. And then finally, we've got our sleep average, again, coming from that aura data potentially, and then overlaid with illness down the bottom. Just to sort of showcase, we've pulled in a few really specific examples from the wearable data that was sort of showcased in our last presentations, and just wanted to show, because it's really topical at the moment, and utilising temperature, heart rate variability, those type of things to again, paint that picture and tell a story with the data. Finally, we know a lot of clients out there are utilising force dex data and force plate data, and just want to showcase a quick sort of report that I built. Again, these metrics can be swapped out for any metrics that you are important to your organisation, and these are not necessarily important to the ski team. This is something that I just put together to showcase that. But we've just got our injuries overlaid over a longer period of time, so our sort of 2-year period, and we see our maximum peak power, and then the athlete sustained an ACL injury following that. You'll notice our trend of data obviously drops down, and we're trying to rebuild them back up to getting to their max and even beyond that, and just sort of showcasing that in a really quick visual that you can change and modify as much as you like. Finally, and just for time, I'm just going to showcase this last piece, which is our symmetry data, again overlaid in that injury data, and just sort of showcasing what that looks like, and flagging any bars that are outside of 15% difference between the asymmetries. Yellow for our between 10 and 15, and then within -10 and 10, we've got our green bars there as an example. So again, some nice cool visuals that hopefully you can take away from this, whether you've got Smartabase or not, to implement and showcase to your programs and to your organizations on how you can visualize this data. That's it for me. I'm sure we're going to kick it back to Charles now for some questions, but if you've got anything, please, feel free to let us know, and we'll go from there. Thank you.
Hey, thanks, Tom. Thanks, Gillian. That was great to kind of go through there. So thanks for taking the time to take us through the system. Tell us about the work that you guys do on a daily basis. And I just want to open this up to questions and field any questions from the attendees of the webinar if they have any, as well as if you had any questions that you may have not already asked, feel free to ask them now within the Zoom webinar application, and we'll do our best to answer them during this time. So there was a couple of questions that came up during the webinar as you guys were going through your functions. One of the first ones that came up was, so Tom, Gillian, is there a possible way to hide names and unhide names for added security within the system that you guys currently utilize right now?
In the reports, you certainly can, and we sort of showcase that hopefully in the injury surveillance dashboard, or we can certainly go through that again at a later date. So you can do that in the reporting features. Around the actual login of data, we have military clients who are de-identifying users in the system, but then you need to obviously know what those codes are and sort of utilize that. So people are doing it. It obviously makes it challenging for certain environments, especially when you've got large cohorts of people. But it is certainly possible if you do want to go down that method, or if it's just really on the reporting side where we're sharing that data, you can go and take out names and put unique codes in there for sure.
For sure. Thanks, Tom. And Tom, this might be another question for you, actually. So you showed us a little bit about like that OSIX and ICD-10 coding system. Is that something that's already preloaded into the system? And then, of course, do you have the ability to make, say, more sports-specific questions as well?
Yeah, definitely. We have some coding. Yeah, we've got a number of coding systems already pre-built in the software. So the OSIX coding is a dedicated sports injury and illness coding system. There's a lot of research out there, and they've just gone and actually updated that coding system that we're going to be implementing shortly to meet those guidelines. In addition to that, we've got the ICD-10 in there, but being from Australia and working globally, I hadn't come in contact with that before I came to North American market, and I haven't found a good way to utilize it for analytics and reporting features throughout the software. So at the moment, the two systems that we have in there, but we can look to inbuild or to place in our own databases or your own databases potentially if that is there. Finally, the Calgary coding system is also implemented in the system. So yeah, we should cover those needs. Hopefully that answers your question, Jason.
Perfect. And this might be a question more for Gillian and Tom, but when we receive notifications through that application, the mobile application for athletes, do you have the ability to have that touch various levels of the organization depending on certain compliances that maybe have not been completed? And maybe Gillian can weigh in on if they utilize that within their own system.
Yeah, the way the notification systems work within our system is basically we can set up notifications through the admin for whoever wants notification on certain information. So obviously we would regulate what that person has access to within the system. And so they're categorized into roles, and based on those roles would give you access to certain reports and information that then your notifications are set based on that, if that makes sense. Those notifications come in by email, and you can be notified every time a new injury is entered, or you know, certain flags are set on the COVID-19 illness surveillance. So that's how our system works. Tom, is there more general notifications that you want to talk about?
Sorry. Tom, did you have anything to weigh in on how that like app notification can go in?
Yeah, so sorry, I'm just going back to the question. So the notification system is certainly available to use. It can also be used in, sorry if I'm going over Gillian's points here, but it can also be used in compliance pieces around open injuries and things that haven't been seen for a while. Those are some areas that we've seen be really cool to, again, increase compliance with your staff. We're always asking our athletes to be compliant, but making sure the staff are all on task and sending out alerts is a piece of the system that you can certainly utilise. Generally, you need data to come into the system to see compliance, but yeah, we have tools to enable us to look at compliance if people aren't doing that and to push out automated alerts throughout the system.
Thanks for clarifying that, Tom. And then, of course, you know, when we utilize the athlete to collect the data itself, how easy is it for us to access the athlete contact information, phone number, or even email addresses within the system? Is that something that we can store within the system?
Gillian, I might let you answer that just as the organizer.
Yeah, sorry, go through it one more time then Charles. I apologize.
Oh, I'm sorry, Gillian. So do you guys do anything to essentially store the athlete and contact information within the system? And how easy is it for you guys to access this type of information?
Sorry, yes, very easy. We have all of that information within the system. We're actually in the process of trying to streamline that so that 8 different departments in our company don't ask the athlete for the same contact information. So we will gather that information from the athlete through Smartabase, through the athlete portal, and then be able to distribute that through the rest of the company. You know, for people who are using in the athletics department, using the system themselves, and then people who are outside of it as well, just being able to document to them that system or transition that information to them through a download. I think that depending again on reporting, we have a report that comes up that's very easy to access that athlete information. There's also in one of our, we have a specific athlete demographics report that we run very easily to get athlete information, and when you hover over it, it gives you everything you need to fill out various forms. We use it a lot for completing insurance reports.
Thanks for that, Gillian. That was a really good explanation on how you guys utilize that. So John from the audience actually asks if the system is compatible with the NCAA injury surveillance program data lists. And then there's kind of a two-part in there that I can ask after that. So Tom, would you be able to weigh in on that?
Yeah, definitely. I've got John's questions here. So some really good questions there, John. So with the NCAA injury surveillance program, we're currently going through that process to tick that box and get that data flowing across. We see that the system, you'll be able to have required fields that are NCAA required, but then you'll also be able to add on to your system as much as possible. So hopefully we should have that up really shortly, and with our sort of continued push into the university and collegiate space, where we're making sure that's a #1 priority for us. Around the other questions, I've got them in front of me, and I think they're really good questions to highlight. You've got the medical history questionnaires and waivers. Yes, we can do waivers in the system. We have wet signatures, so they can do that through the mobile app. And then also the electronic signature is being recorded as well. So yeah, we sort of certainly have a number of clients utilising that feature. And then finally, you've got a sort of kiosk mode that you've mentioned there. And again, the answer is yes. We have that kiosk feature to basically utilise on a team level and to basically push out to organisations. So we get that mass interaction with athletes and those type of things. I think if you've got any further questions, they're specific, but they're great to ask, and we can follow up in a demo if needed.
Perfect. Thanks, Tom. So one of the last questions that we have here that would be a little bit more geared towards Tom, but is there a way to look at data at the aggregate level of analytics, which allows you to view the population level recovery patterns following specific injuries? I know that's a little more specific.
So the system's open to a number of different analytical tools. We've got R integrated into the platform. So basically, without sort of going into that sort of specific question, I'd say certainly the answer is yes, with tools like R to basically drill down into those levels of data. If you've got it in there and you've got the expertise to do that. Our own data science teams can help clients, but we need to have those questions obviously established before we go in and actually answer them. Hopefully that answers your question.
All right. Thanks, Tom. And sorry to throw you that curveball there, but we're kind of coming up on an hour now. So if we didn't get to your question, we'll look to follow up with you specifically to answer them. I want to take this time to thank USSA and Snowboard for the partnership and giving us an opportunity to showcase their Smartabase site, as well as Gillian and Tom for taking the time out of their busy schedules to share their insights, let us pick their brains, and share with us their work with Smartabase, as well as those in attendance. So we will actually have a survey at the end of the webinar, and any questions or comments on any future subjects that you would be interested in hearing about, please let us know within that survey. And then, of course, if you had any questions on specifically implementing something similar to what you saw here today within your own organization, definitely feel free to reach out. What I have here on the screen as well is, just the contact information for Gillian, Tom, and myself, if you guys wanted to make any connections to talk a little bit more about what we talked about today. We hope that everyone has a safe and wonderful weekend. And again, thank you for attending.
Thank you, everyone. Cheers.
Yeah, thanks, everyone. Bye.